Please join me in welcoming our presenter today.
Thank you, Cindy. Thanks to the League of Women Voters and the library for enabling us to have this presentation. I want to make one correction to my resume. I tell people that I've always been from Iowa City. I just didn't get here until 1985. So Iowa City has really opened its arms to my wife and myself, and we love it here. I want to set a little context in terms of when I think of affordable housing, who we're talking about. And my concept of it is that the people who work here should be able to afford to live here. And it's a very simple, equation. So when we talk about affordable housing, what we mean is housing for daycare workers, the waiters who serve your food, the people in retail and service jobs who tell you to have a good day and then are looking forward to a 45-minute commute. They can be the kids of your neighbors, the empty nester from a broken marriage, the young woman with her shiny degree in sociology who is looking for her first job. In short, it could be you when you're younger or when you get older. It could be you, it could be your children, it could be your grandchildren. This isn't some abstract group of people. This is us. So I want to kind of make that clear. My background is an economics background, and that's where my focus is. But fundamentally, what we're trying to do is serve people. So there's a lot of moving parts to the question of affordability, and everybody has a perspective on it. I'd kind of like to sort of delineate how I think about it. There's one line of thinking that's focused on the rental market and the people who rent, and then there's the people who own. So we're talking about home ownership versus rental. Very different sets of circumstances, very different policies that apply to those. We're also talking about strategies to keep people in their homes, whether that be an apartment or a single-family home. And we also are talking about strategies in the development of new housing. So how do you promote new housing that incorporates affordability? And just as an aside, I was reading the New York Times this morning, which I do treat myself about every month to, and there was an article in there where they had 300 apartment units, affordable apartment units in Brooklyn that they put up for auction, and there were 90,000 applications. We've got our problems, and I don't want to, limit those, but there's a lot to be said for, perspective on what we can do. Fundamentally, as an economist and an appraiser, my loyalties and my interests lie in the area of existing housing and rental housing. What I'm interested in is how you prioritize money, how you spend money strategically to get the biggest bang for the buck. It's not a particularly popular position, but my position is that new and affordable are virtually mutually exclusive. New and affordable, I think, are mutually exclusive. That's a broad generalization, but I guess the point is that older rental housing is, I think, where I would put my focus in terms of trying to get the biggest bang for the buck. How do you serve the most people most economically? The second principle that I put out there is it's very difficult to develop affordable housing when you're paying in excess of $50 a square foot for the land. Affordable housing begins with affordable land. And there's a lot of ways that plays out, but the closer you get to the central business district, the more difficult it is to develop affordable housing or to have affordable housing. A third principle that I use is density is affordability. There's a reason why estate properties sell for a heck of a lot more than a suburban condominium. Density determines affordability. One of the things that Cook Appraisal does, and by Cook Appraisal, I'd like to take credit for that because my name is on the business. But in fact, I sold the business a year and a half ago, and a long time ago, I hired several people that are a lot smarter than I am, and they are now the owners of the firm, one of whom is Rochelle Dedeker. Rochelle and her assistant, Adrian Marcos, are the ones that are responsible for our rent survey. And we've been doing this every 2 years for I think over 20 years, but frankly, I can't tell you how long it's been, but it's been a long, long time. And so we're able to see trends, how are vacancies changing by different areas of the city, how are rents changing. And in some ways, it's been a little bit like being a weatherman in San Diego. There's been a lot of churning, there's been a lot of, change, but the vacancy factor has consistently, for 25 years, been below 4% citywide. And not just citywide, but Coralville, North Liberty, and Iowa City. So this year, we looked at 6,000, we looked at a lot more units. I think we had like 10,000 units that we surveyed. But we were able to make comparisons from 2 years ago to 2017 for about 6,500 units. And 6,500 units is a pretty good sampling, and that includes Iowa City, Coralville, and North Liberty. And the results, and I was just really looking at these closely, and the data it's a ragged bunch of data. I mean, there's nothing real clean about it. But one of the things that is notable is that from 2015 to 2017, the increases in the cost of apartments has gone up, aggressively. And in part, you think, oh, it's these rapacious landlords. And I don't want to comment on that. Yeah, some of them are, but there's a wide variety of landlords. And but mostly it's been skewed by newer units have been coming on the market. And so for example, one of the things that's not in our rental study, so have got a kind of a scoop on this, is we took an inventory of all the units that have been built 2017, those that were firmly projected for 2018, and what our expectations are for 2019. We subtracted all the units that have been demolished. And if you think about it, the quadrangle's been demolished. A lot of the units out by the Mormon-Trek Boulevard, the family housing out there, those have been demolished. So that's an important part of what we're talking about if you're going to get an inventory of what's, what we've really got and what's coming online. And then there's also kind of a natural absorption. So historically, the Iowa City area has been able to absorb about 300 bedrooms without really moving the needle on vacancy. So if I'm just going to grab my water because I'm starting to seize up. So the results of that are there's been pent-up demand, generally a market that's at what we call equilibrium, so that it's a balance between the buyers and the sellers. You get about a 5 to 6% vacancy. That's what you would expect. If the market is at the vacancy is at let me just tell you for sure, 4.4%. That's the overall vacancy of the whole Johnson County market. Then that means there's pent-up demand. That means that there are fewer units than what we need, to serve our population and the growth that we've had. So our expectation, is that due to the, let me just tell you exactly. In 2017, there was a net number, and I reduced it to beds, not units, because there's 1 units, there's efficiencies, 2 bedrooms, et cetera. 1,567 new beds came online. 1,049 of those beds were developed by the university in their dorm the Elizabeth Catlett Residence Hall on the river there. If you haven't seen that, it's really something to see. I mean, this is a serious building. So that accounts for about 2/3 of the new inventory that came on in 2017. The big news is in 2018, we expect 2,432 new beds, and whatever there was in terms of pent-up demand will have been satisfied, and then some. And then there was 144 demolitions, so we have a net new beds coming online in 2018 of 2,288. And then in 2019, and this is, when things get that far out, it becomes less and less reliable. But what we have been able to count just preliminarily is about 706 new beds. What that does is it will raise, we expect it to raise area-wide vacancy from our current 4.4% to at least double that. So we think between 8 and 9%, that's what we expect. And frankly, most landlords, the big landlords, have what we call a very deep equity position. They don't owe a lot of money on their units, and they will do perfectly fine at 8 to 10% vacancies. So I know you're all worried about, will the landlords make it? Maybe not. But what that does is it puts downward pressures on their ability to raise rents. And our anticipation is that not only will they not be able to raise rents, but tenants will have greater choices. And the older units, there'll be some pressure to spruce them up, fix them up, to actually work a little bit harder to get your tenants. The problem is that while rents go up pretty fluidly, they come down a lot harder. It's kind of a ratchet effect. You've seen what do I mean by a ratchet? It goes one way. But what you don't see is that there's a lot of concessions that happen. And concessions happen when the vacancies go from 5% to 8%. And those are it's hard to suss those out. So you might not see, stated rents, this is what we're getting. But what I think you can expect is that concessions could wind up being between 10 and 15% of the rental costs. The point that I would make in light of this data is that landlords are an integral part of the solution to affordable housing. They have to be intimately involved in the question. They will be more amenable to working with agencies like Shelter House and people that are seeking affordable housing than they ever have been. And the interesting thing is that these vacancies, these 8 to 10% vacancies, disproportionately fall more heavily on older units and units where most of the construction is going on. So surprisingly, they're falling disproportionately within a mile of the Pentecrest. But frankly, anywhere there's older units, they are more likely to suffer from vacancies than the newer units. And we actually did a study on that. What do we expect the vacancies to be for properties that were built before 1990, and what were the vacancies after properties that were built after 1990? And there really is quite a disparity. And I guess I'm thinking this is the last point I want to make, and then then we'll turn it over to Crissy. But I want to just say I took a tour of Shelter House after being badgered by Carrie Norton for probably 12 months. I don't know how long it was, but anyway, I finally said, okay, I give up. I went over there, and I really strongly recommend everybody to give that a shot. Nobody is more entrepreneurial, more effective at addressing the needs of the most vulnerable people in our community for affordable housing or lack of housing. And one of the things they do better than anybody else is coordinate with landlords. So landlords are not the enemy. Try not to antagonize them needlessly. They are an integral part of the solution, and I don't think anybody has been as effective in making that happen as a shelter house. They are the bridge between people who don't have homes and people who have homes and need someone to move in. That concludes my remarks. I'll look forward to taking questions after the other speakers have finished. Thank you.
That was very kind, Casey. I don't know what to say. Thank you. Whoops. I think I may have turned the lights down. Okay. And I'm looking for, okay. So thank you for this opportunity to speak with you today about the work that Shelter House is doing to provide housing opportunities for the most vulnerable in our community, specifically those that are at 30% or less of area median income, people who are experiencing homelessness in our community. Most folks are very familiar with Shelter House in so much as we are a homeless service provider. We provide emergency shelter, but we are so much more than that. We not only have the emergency shelter at Southgate Avenue, but we have the low barrier winter shelter that started about 4 seasons ago and is wrapping up actually tonight is the last night for that. An intervention that's really targeted for the chronically homeless in our community, where we've removed barriers such as sobriety and program expectations for folks, so we can at least provide that essential service of shelter for folks during the coldest months of our year. We have drop-in services every day, so that provides a different intervention point for folks to be able to come in. If they're not interested in staying in shelter or engaging in other services, they can at least come in and have access to laundry, shower services, our staff to meet for kind of outreach and referral. That's on a daily basis at Shelter House. We provide meal service for the folks residing at shelter, and also meal services for Prelude Behavioral Services and youth homes. So we have a small cottage industry, if you will, within the organization. And rapid rehousing, this is what Casey was talking about as far as our work, our effort to really build relationships with landlords and property managers throughout our community, because we need those relationships and those partnerships. They are a very substantial part of the equation to helping people move from homelessness to housed. And rapid rehousing is the intervention through which we frankly place the most people that are coming through our doors into housing. So we're working with individuals and families to get them rapidly out of a homeless situation, out of the shelter and into their own housing, and then continue to work with people for anywhere from 6 to 9 months after they've been housed, and providing those stability services so that they can retain their housing, get back to work, retain employment, and become more engaged within the community. Supported community living services are our longer-term case management. We became credentialed through Medicaid a few years ago, and so we're able to continue support services for folks that are qualifying for those services. And Fairweather Lodge, which was our first permanent supportive housing program, which started in 2011. And I'll speak a little bit about that experience towards the end of the presentation. And Fresh Starts is a supported employment program through which we're ensuring that anybody living in our permanent supportive housing has employment. It's a janitorial program. As Cindy said, though, today I want to talk primarily about a new initiative that we'll be bringing online towards the end of this year. It's our Housing First program, and that is a permanent supportive housing program. And I want to talk about the context which has led us to that as a new intervention that we are bringing to the community. So just a few things. This is not news to anyone in this room, but the fact that Johnson County sits astride the intersection of 2 major interstates. We have 3 hospitals, each with psychiatric inpatient units. Those 2 issues combined do lead to a higher occurrence of chronically homeless individuals in our community than other areas in the state. And Casey's here to keep me honest. We have one of the highest cost housing markets in the state of Iowa and among the lowest vacancy rates, which is, Casey mentioned, that's changing. But that indicator does also place pressure on those that are seeking affordable housing. It makes it just that much more difficult for folks that are at 30% and below area median income, so a slightly higher incidence of homelessness in our community in general than other areas of the state. So to contextualize Housing First specifically and our organization's proposal to bring this intervention to the community, there were several things that happened. First of all, in 2013, the City Council passed an ordinance restricting panhandling and where people could lie down, where they could store their property. And during those conversations, public presentations, we started to use that opportunity to talk about longer-term possible solutions to addressing chronic homelessness in our community, rather than really focusing on the short-term impact of that ordinance. We took the longer haul and started talking about bringing Housing First to the community, and I'll speak to exactly what that means. That same year, towards the end of the year, the polar vortex happened. Maybe you'll remember it was an absolutely bitter winter. And during that winter, there were quite a number of people that, in the chronic homeless population, not coming into shelter house on the Southgate Avenue shelter, but coming into Iowa City Police Department, City Hall. And that was not unique. City Hall has consistently throughout the winters allowed people to come in and on the very coldest nights to sleep on in that general entryway. What was unique about that winter, though, is that it was night after night after night, and that the numbers weren't just 3 or 4 people. It was upwards of 15 to 20 people sometimes that were coming in, and there were just no accommodations to support that. So it was actually the city staff and police department that came to the local homeless coordinating board and said, you know, we need to be better prepared for our winters here, and is there something that we together can do to address the needs of folks that are chronically homeless and ensure that they're not out there on the streets. And it was from that experience and the city reaching out to the local homeless coordinating board that we started to move forward with the proposal for a low barrier winter emergency shelter. So those two things allowed us to really move forward as advocates and introduce the Housing First concept in a different way. And I think that it resonated with leadership throughout our community in a different way, because there were just kind of this alignment of interests, if you will. It was then at that time that we decided that we would dig into this opportunity and formed, this language gets a little clunky, but we formed a cross-system steering group and felt that we wanted to start by identifying local frequent users. Again, a clunky term, but it really is just intended to quickly identify who we're talking about, or those familiar faces that we see throughout the community. And these are the individuals that are chronically homeless, but further are frequently cycling through our different systems and services, only to resolve by ending back on the streets of our community. So individuals that are passing through emergency shelter, emergency room, treatment services, jail, and back to the streets in no particular order, we felt that this was the place that we wanted to start and to better understand these individuals and the experiences. And so that was the reason for forming this group. So the group had membership from everywhere from the Iowa City Police Department, the Housing Trust Fund of Johnson County, Shelter House, Prelude Behavioral Services, the Housing Authority, I'm blanking out here. Abbey Health, so quite a number of different providers. University of Iowa Hospitals and Clinics was a member, and everybody committed to coming together regularly to work to identify individuals that would fall into this particular cohort. I'm going to need some water too. Okay, so this is just a graph that starts to better illustrate who it is that we are talking about within the homeless population. So if you can consider this pie chart in its entirety as the homeless population within any community, about 84, 85% homelessness is a very short-term, one-time event. And for those individuals, the rapid rehousing services that I spoke to earlier, that is a very effective method to helping people move from homelessness into their own housing. And that is the work that we do for the majority of folks that are coming through our doors. It's the 16% that the needs are much more complicated and layered. This 16% is the chronic homeless population, who by definition have a disabling condition. So chronic is not just related to the episodes of homelessness or the duration of homelessness. Part of the definition criteria is also that an individual has a disabling condition. So serious persistent mental health issue, health diagnosis, substance abuse, chronic substance abuse, or physical disability. It's that 16% that the general services that we offer, they're not that effective. We can help people move on. They may get into housing, but they'll cycle back into homelessness. Or they may not even come through our doors. So it's either partially effective but not sustainable, or it's entirely not reaching that population. And it's because of the experience in trying to better serve and reach the 16% that we started moving into permanent supportive housing in 2011. And it's actually this very small sliver, that mustard color, right, that's in there. That's about 4% of the population. It's in better understanding the needs of that very small cohort, which are our frequent users, that compelled us to move forward with Housing First. So although this is a very small percentage of the overall population that's experiencing homelessness, they are costing, if you will, the predominance of cost throughout our community. And this is not unique for Iowa City or Johnson County. This is across the country. It's been the experience of communities throughout the nation that have started to better understand this very small segment, these frequent users, that there's very substantial cost being incurred to essentially allow for them to continue to live on the streets. So this is trying to essentially illustrate this circuit that happens for people that are in the frequent user population. It makes it look like it's very orderly, when in fact these arrows should be going in every possible direction. There's no consistent order to this. This experience for individuals is very crisis driven. And again, this is just really to convey that the individuals that are in this frequent user population, they're circling through in no particular order all of these different interventions and consistently resolving by ending up back on the streets of our community and those across our country. And if folks are familiar with kind of that 80-20 rule, within medical services, that 80% of your resources are going to 20% of your patients. It's almost more so 90-10. And this is consistently the case for these individuals too, within the service sector. So going back to that cross-system steering committee, we decided that if we were going to go forward with Housing First, and that this was the cohort of the population that we wanted to really focus on serving, this frequent user, the first thing that we needed to do was to better identify what the local costs were. And so working with everyone who was coming to those meetings and participating on this project, each individual went back to their place of work and started to collect data on what the local costs were for providing the different services. Now this data is dated. This is from 2014, and we haven't updated it yet. But we took what we found as far as you can see, and hopefully it's legible for everyone, going from hospital inpatient, emergency room, psychiatric hospital. We took averages across the different medical providers to get those figures. And then detox, jail, transitional housing, and shelter. Those are from our local nonprofit organizations. Well, not jail. That is not a non-for-profit. But This information, it was a long process to gather this information. It became a rather sensitized process, which is why we agreed to do averages for things where there were multiple providers, and very detailed, even down to the quarter hour of service. So there's spreadsheet upon spreadsheet supporting this information. What we wanted to do also, though, was to make sure that we had a good baseline that we were establishing, and so we compared that to content that had been generated by the Interagency Council, and that's that blue chart that you see. And we feel that the information that we generated is relatively consistent with the information that they have for a national level. There are just some small exceptions, but realistically, we believe that this created a good baseline for us. Now, this was important because what we wanted to be able to do was to identify the overall cost that individuals were incurring within this cohort of the population. So we needed these multipliers, if you will. From that, then, the team went through a list of about 26 names of individuals that were known to be homeless and unsheltered. So folks that were not consistently using shelter house services, but those folks that were known to be unsheltered and homeless and had the highest occurrence of interactions with local law enforcement. So this is public data because we started with public records, the police data, if you will, and took that public information and passed it around the circle of providers, and people just kind of nodded and took mental lists of the individuals that they knew that they had a good rapport with. And then we're tasked with going out and finding the individuals and seeing if they would agree to work with us to sign off on the necessary releases so that we could gather the service utilization information and begin to develop case studies of these individuals and their experience from a cost perspective of their service interactions. So from that list of 26, it was narrowed down, and finally 4 individuals agreed to work with us and sign off on all the needed documentation to be able to access their records. From that experience, then, we were able to generate case studies for these 4 individuals over a period of about 4.5 years, because some people went away and then came back. We didn't necessarily have their entire information if they left the community for a period of time. So the actual months comes out to be about 4.5 years total. These 4 individuals, and this is the costs for each individual, their average cost per year per person, over that studied period. And these are the costs that are ranging across everything, again, from emergency room, jail, shelter, ambulance services, the whole thing. So you'll see a range here on the low side, Kent, just under $57,000, to the high, Ted, at just under $200,000, and this is per year, for an average per person cost of just under $140,000 of unreimbursed costs per person per year, only for individuals to resolve by living back on the streets. And we thought that this was very significant. And this is just 4 people out of what is a much larger number of individuals, and this circuit is very consistent, or these experiences are very consistent for the larger group, if you will. We aren't the first community that has done this cost analysis. We won't be the last. And I can tell you that in working with my colleagues across the nation, that these findings are very consistent with what providers are finding in their own communities. Because our interest is primarily focused on ending homelessness, we think that one of the data points that was the most telling is the nights sheltered for these individuals. We metabolized this information and broke it apart in every possible way, and I could share probably 30 different charts. They're quite numbing over time. But this one, I think, speaks very directly to the inefficiencies that exist as far as our approach to meeting the needs of this particular cohort of the homeless population. Essentially, when I look at this slide, it is just saying to me that we are sheltering or housing individuals in the most expensive possible way, and it's not effective, it's not sustainable for them, they're ending up back on our streets. And so what could possibly be the argument against just simply providing them a home? So throughout the entire study period, at least 1 out of these 4 individuals was in one of these interventions for every single night of the studied period. Does that make sense? I really struggle on how to make this make sense in a short period of time, and Carrie has tried to help me time and time again, but I think if you just kind of have a moment to look at this, it starts to really jump out. So if we pull all the costs together, this pie chart just demonstrates how those costs break out for these 4 individuals. Over the research period, a total of $2.16 million, with the vast majority of the costs incurred falling under the medical and mental health services. I think it's about 80% of the costs. Because we're talking about a group of people who are very sick, and they're very poor. And so this is not a Photoshop image. This is a picture underneath one of our bridges in our community. This is an encampment that a couple of the guys within our study group have lived in. And in the context of our experience, what this has said to me is that we've been willing to, or that we just have because we've not known of other ways, to spend over $500,000 a year for 4 people to live like this and to die like this. And it just is not tenable, and it doesn't make sense. 2 out of the 4 people that we worked with have died while living on the streets of our community since we ended this research project. And we know, because we've seen other communities do it, we know that we can change that. And it doesn't cost what this is costing. So Housing First is the solution that we're recommending, and it's the solution that we as a community are going forward with. Shelter House is the lead organization on this project, but I want everybody to understand that this has been a community-wide initiative. We would not be able to go forward with this if we hadn't had the support of all the different partners that have worked with us along the way. What Housing First is, it's a permanent supportive housing intervention. And permanent supportive housing means that you combine that affordable housing element, so a home, affordable home, and the supports necessary to help the person maintain that home. So you just tie the 2 together. The thing that is very different, and some would say radical, about Housing First is that it takes the old way of doing things and turns it on its head. The old way of working with folks that are experiencing homelessness has been to go through a very progressive process, which is known as Housing Ready, and working with people to help them essentially go through different steps where they're sort of kind of proving to you that they're able to take on housing again. It may sound arcane, it may sound very rigid, but it is the way that homeless service providers and in fact the federal government, our nation, has approached homelessness for almost 30 years. That way is changing, and in fact I'd say it's changed. And we're turning it on its head, going to a more rapid transition from homelessness to housed, because we've learned and understood that as much as you try to create an organized, structured, and safe environment within a shelter, there is nothing within the homeless experience that is stable. It's chaotic, it's volatile, and it is very difficult to help people to help them move forward in their lives and address their health issues until they're actually in the safety and security of their own home. And so that is a part of this transition and this move to Housing First, and you're going to hear about it as a transition throughout the entire organization of shelter houses. We are really changing internally how we're working throughout the continuum of our services to be more Housing First in every aspect. So rapidly taking people that are experiencing homelessness, moving them into their own homes. For this means that we will be identifying individuals that are chronically homeless, that are falling into that frequent user cohort. So we'll need to understand and verify people's service utilization and offering them a home first. We're not going to go to people and say, well, if you take these medications or if you sober up or if you agree to work with us, we've got a place for you. It is a radically different conversation. If you are homeless, we have a home for you. And we have that home because we have the partnership throughout the community. We've been able to fund this project, and actually the partnership of the Iowa City Housing Authority, which I'll speak to in a second as well. It sounds like a very simplistic approach, but it's not. It's very involved. You have to have the established partnerships with all the different providers in your community, behavioral health and health providers, to be able to support individuals as they're in the housing. And we do have those partnerships, and we have those entities engaged and committed to working with us. The other radical part of this, though, is that participation on the part of the individual that's being served or housed, the tenant, is entirely voluntary. So you cannot place restrictions on an individual's tenancy. You can't put programmatic restrictions on them. And that, again, that's also part of the very innovative or radical shift that's happening here with the Housing First approach. So the services on the part of the providers, that has to be there, that's committed. But as far as the participation of the folks that will be housed, that has to build over time, and it's entirely voluntary. Other communities that have gone forward with Housing First have been able to show about a 60% change in costs, and this does not mean to the overall community. This means for the individuals that are receiving services. So they've been able to show that for individuals pre versus post housing, compared to their homeless experience versus after being in a Housing First permanent supportive housing program, their utilization of services decreases quite significantly. And for us, we should be able to see very radical changes if we follow the same trend lines as other communities across the country that have gone before us. This is an image of the building that we're moving forward with. We are actually, I can announce we're having a groundbreaking on April 5th. And the property that we have secured is located at 820 Cross Park Avenue. This is a two-story building with 24 one-bedroom apartments, very efficiently sized apartments. And there'll be on-site case manager offices, a clinic for behavioral services and health services to be available on-site. So Newman Munson, as the architect, has donated all their services on the building, and I think that's actually in my next slide, maybe the next two. But a couple of things that have gone into this project and made it possible to move forward relatively quickly compared to the experience that we had in bringing the new shelter online back in 2010. You know, so much of this came because of the leadership of the City of Iowa City. In July of 2016, the City of Iowa City amended the zoning code and created a new housing type, long-term community housing. For us, this meant that we were able to go forward with our project in an appropriately zoned area without facing legal opposition. And if you'll remember back to the shelter experience, I see many familiar faces here. That cost us, frankly, 6 years. So that was huge. In October of 2016, we purchased land. As I mentioned, all the architectural services and also all the engineering services, HBK and Modus, have donated all their services on the project. And as of August of 2017, we've secured what I understand now is about 90% of the funds, because the project was bid out and we have the actual cost of the construction budget. But I want to mention Housing Trust Fund of Johnson County and the Iowa Finance Authority National Housing Trust Fund dollars are funding the project. And we'll break ground in March with, again, the ceremonial groundbreaking in April, and you're all welcome to join us. I think I've probably exceeded my time, but I just want to take a moment, if I can, to talk about the Fairweather Lodge, because it was also this experience in providing permanent supportive housing since 2011. Not a housing first approach, very different. It's community living and community support model, but for people who have experienced homelessness and have a serious persistent mental illness, so diagnoses of schizophrenia, bipolar disorder, anxiety, serious depression, living in a community environment and working together, that we were encouraged and emboldened, frankly, to move forward in developing permanent supportive housing options for our community. So this just talks about the different aspects of what the Fairweather Lodge is, and so it's communal, peer support, so peer-driven, supported employment, and on-site mental health treatment and medication management. I spoke to the population that we serve here, so I'm going to skip through this slide, but I want to get to this information here. We were able to look at the individuals that participate in our Fairweather Lodge program, and over a 5-year period, look at their service utilization, pre-housing versus post-housing, and these are the kinds of impacts that we're seeing for folks. So again, we really feel that this compels us to continue to develop out the permanent supportive housing options for those individuals that are most in need, even within the homeless population. These impacts are very substantial, and this doesn't begin to talk about the transformations that we see in the people's lives in knowing the individuals. So with that said, thank you very much for your patience.
Hello, I am Tracy Hightshoe with the City of Iowa City Neighborhood Development Services. Some of you I've seen the face probably have seen this presentation before. And a lot of it supports what Casey was talking about. There's a lot of questions about what is affordable housing, what is affordable housing to us in Iowa City. In general, affordable housing just means that you're paying less than 30% of your monthly income on housing expenses. For the programs that we administer, whether they be community development block grant, home funds, our inclusionary zoning programs, we're typically looking at what's 60% of a median income for rentals, and we go up to 80% of median income based on family size. So these are the 60%, 80% median income limits, and this is what you would have to make in order to be at the maximum of those limits for most of the programs that the city administers. These include affordable housing is needed by many people. I mean, these are just the salaries of jobs that we need in Iowa City. These are the folks, as Casey said, that are providing all the service jobs in our community, that provides home health care, that provide a lot of things that we need. And I always say that our metro area needs people who need affordable housing. And our premise is that is if you work in the city, then you should be able to live here. It's a much more sustainable community. We did a market analysis, or a housing market analysis, back in 2007. We did an update in 2015. We have over 2,000 cost burden rental households, and we set age 25 and older because we have a perception that in Iowa City that we need affordable housing, and we only need affordable housing for university students, you know, our typical undergrads. So we removed the typical undergrad out from the study to basically say we still have close to 3,000 families that need affordable housing, and they're not going to school here. They're just working here, and they need that housing. You can get some of our recent trends from a study, and I put the, nope, I took it out. So at icgov.org/action plan, you can find all our studies that we've done. The first two are from that study. Basically, we have rising housing costs, and we have people making less money, and that trend has been there since 2000 to 2012. More people in poverty are living in our community. And what was recently, our city manager provided a graphic that the U.S. Census Bureau did, and it shows that Johnson County is raising in the number of people, and all of Iowa is raising in the number of people, but it's mostly because of our influx of immigration, our immigrants coming to our area. Johnson County, Polk County are two of the counties that have a lot more immigrants coming into our communities than the rest of the state. So we grew by 8,481, 2010 to 2016. and over 5,000 of those were immigrants. And I've been here since 2001. We work in a lot of low-income communities, so we try to communicate in low-income neighborhoods about what their needs are, how we can improve services that we provide. And it's growing increasingly difficult because now it's not barrier of poverty, it's that barrier of languages. When I talk to other cities, they can go into a neighborhood and it'll be all Hispanic, so you just need one Spanish translator. When we go into some of our neighborhoods, I'm now looking at, I need Arabic, I need Congolese, I need Sudanese, I need Bengali. I don't even know how to pronounce that. Half the time, I'm amazed I got it right that time. So we're trying to communicate with these neighbors, but it's just difficult. And sometimes I'm translating through a 4-year-old, trying to get that information back and forth. Rents are gone a lot higher. I've seen in the last 2 years a big jump in what we call a fair market rent. That means HUD does a survey of the area and what's about 60% of the rent. When we have affordable housing projects, we basically say we want rent that's comparable in the community. So basically, sorry, it's 40% of rents. 40% of the rents are lower, 60% are higher. So that's what we consider fair market rent. But that's still really high for a family that's only making $12 an hour to pay. Our premise, and you'll see it in our strategic plan that the council has, is that we want to foster healthy neighborhoods. We want communities of opportunity, and that means you have access to parks, you have good schools, you have access to employment. So a lot of our work in neighborhood services is to make sure all of our neighborhoods throughout Iowa City have these things. My division is responsible for a lot of our programs that deal with housing, whether it be owner-occupied, neighborhood stabilization. We have the Housing Authority, the Housing Choice Vouchers, which a lot of people know as Section 8. We have the public housing units. And I always want to clear up whenever I speak to a group, I always want to clear up some misperceptions about Section 8 vouchers. All of our vouchers that the Iowa City Housing Authority administers, it's just not in Johnson County, it's just not in Iowa City. We administer all these vouchers for Johnson County, Iowa County, and parts of Washington County. 60% of the people that we serve are elderly to disabled. And out of that 40% that aren't elderly disabled, they're working. Less than 1% of the households say that welfare is their only source of income. So these folks are working in our community, but they're just not getting paid that much, and they're struggling. And people that, you can live anywhere with a voucher. As long as that landlord's willing to accept that voucher, you can go there. So I provide a map of just like in Iowa City, Coralville, and North Liberty. In Johnson County, primarily, our voucher holders are living in our metro area. We have some in Hills and Lone Tree, but for the most part, people are choosing to live in Iowa City, Coralville, and North Liberty, and Johnson County. And I always want to provide an example of what affordable housing to us looks like, what we're subsidizing. This is a low-income housing tax credit. You might know it as a LIHTC project up in Mackinac by the Housing Fellowship. This is the peninsula, both rental housing and owner-occupied housing. We also like to assist the private market. You're going to find a lot of low-income people live in existing multifamily properties. So whatever we can do to maintain that property, because the first thing that goes when you're, sorry, can you hear me now? When you see a multifamily property, if they're struggling with cash, the first thing that goes with is maintenance. So what we try to do is help our multifamily landlords with programs that revitalize and rehabilitate the housing stock. This was a LIHTC project for affordable elderly care over on the west side. The Housing Fellowship owns primarily a lot of single-family homes throughout the community. We also, it used to be called, I know it is Community Mental Health Center, but Prelude now, it used to be Mecca. They have a transitional housing facility for 12 apartments for people under substance abuse treatment. This was another LIHTC project. These are all rental properties in Iowa City. And then with the flood, we received millions of dollars, I think $6 million, to provide down payment assistance to people under 80% of median income to buy their homes. We built 141 homes. Some were single family, the most were like townhomes, capped it at $180,000. And I think you got a 25% down payment, but we were able to build 141, and we prioritized first-time homeowners, and that was a program that assisted many people get into their first home. Then back in 2016, our city manager asked us to go along with the city strategic plan, what can we do locally to improve affordable housing? It's been a problem for years. So we sat down with finance, police, our department, Development Services, and came up with 15 action steps, and we took it to city council saying, which ones do you want us to pursue? And city council said, all of them. So we're working on those, and that's just been since 2016. So we continue to fund our existing programs, including GRIP. Are you familiar with the university program? It's a program that's mostly to stabilize downtown properties, but we have purchased 65 homes to date. We've sold 58. 16 have been to homeowners under 80% of median income. So it's not necessarily an affordability program, but it is a program to stabilize neighborhoods and to improve the health and the stock of those homes. We've adopted inclusionary zoning. So that means in our riverfront crossings district, south of Burlington to the highway, some properties west of the river, basically, if you're going to have a new development, we upzoned it. So if you're going to build higher density, then 10% of those units have to be affordable at the home fair market rent. So you're seeing them now. They're being built now, which is what Casey was talking about, the number of beds be increasing in our riverfront crossing. So we'll see at least 10% of those units affordable.
I have two quick questions about Section 8 in Iowa City, President County. One is, how long is the wait list here? And the second is it lawful for landlords to discriminate based on source of income?
In Iowa City, no, they can't. They can use the same criteria. So if they're going to look at credit scores or past references, as long as they're doing that for everybody, it's okay. But they can't just look at if you're getting a Section 8 voucher. And that was the first question?
How long is the wait list?
That all depends. If you're a resident, we're pulling, I think, people from 2015, I believe, right now. Yeah, thank you, Robin. So I'm right, 2015? If you're not a resident, you're basically probably never going to come up to the top of our waiting list, just because I think there's, what, 7,000, 8,000, Robin?
I'm sorry?
There's about 7,000, 8,000 on our waiting list that aren't residents.
It's about 17,000.
Okay.
If
So
you're from Iowa City, you get in first.
if you're from our jurisdiction, so Johnson County, yep, our jurisdiction.
Tracy.
Oh, sorry. Her question was if landlords can discriminate based on source of income, which is Section 8. In Iowa City, no. In areas outside of Iowa City, so Coralville, North Liberty, yes, they can. We have a different ordinance. Then the other question was, what is our waiting list? And if you're a resident of our housing authority jurisdiction, probably we're pulling applications from 2015 right now. If you're not a resident, you'll probably never come up to that waiting list because we'd have to go through our resident waiting list first. So that would be indefinite. So those are questions. We adopted a code amendment back in 2016 that had now enabled the shelter house to proceed with the Refuse project. We now provide a line item in our budget for affordable housing. And fiscal year 18, that budget was $650,000. For fiscal year 17, it's $750,000. If the state, something about the commercial tax backfill, if the state doesn't take that away from us, then I think it goes up to $1 million. Those funds that we're giving every year, it started off with $1 million, then it was $650,000. Last year it was $650,000. 50% goes to the Housing Trust Fund of Johnson County to administer for Iowa City projects. We're now trying land banking. 25% held in reserve for land banking. We're up to about $614,000, so we are now looking for land to buy so that we can place affordable housing on it. We've reserved 5% for emergent situations. That's not clearly defined yet, but we did spend some money when Rose Oaks, to those tenants who were displaced out of the Rose Oaks. We're hoping that doesn't happen again, but we do have some money for that type of situation. And then we directed 20% of our money for LIHTC, that low-income housing tax credit. We just got good news. The Housing Fellowship applied this year to Iowa Finance Authority, and they received an award. So there'll be 33 new units on Dubuque Street. Anybody here from the Housing Fellowship? Okay, you're waving. So Dubuque Street. So they'll start proceeding. We provided $330,000 for land banking, so the Housing Fellowship was eligible for that money, and those funds will go to that project. The Housing Authority has $1.5 million due to prior funds or program income coming back. We're using that money judiciously about where we can to get new affordable housing, either downtown or on the outskirts of town. Augustus Place is if anybody knows where City Hall, that parking lot that used to be behind City Hall, that will be a residential development, and we will purchase 6 units in that building for affordable housing. At the Chauncey, we'll have 5 housing units that might be part of our public housing or just affordable housing. We don't know which program we're going to put it in. But there's about 420,000 remaining in that fund. We are going through an annexation policy right now, basically saying if we annex land and it's going to be more than 10 units of residential, we're going to work with that landowner to talk about, can you sell the land to affordable housing provider? Can the city buy it for land banking? Do you want to apply for LIHTC? We're going to start negotiating more about, and our goal is that 10% of the units coming online will be affordable housing in some form. And then we're going to start using tax increment financing. Our first opportunity might be with McAllister Boulevard on the south part of town. If we provide tax increment financing for residential development, then a certain percentage of that funds have to come back to us for affordable housing in anywhere in the community. So we don't have to use it where the money is, where the source of the money is. We're going to start regulatory changes to our city code. As Casey said, we're going after density. It is really hard to provide affordable housing if all you can fund is single family, one roof, windows. If you can provide density, so if you can do 30 units, but you have to have zones that are willing. Like our zoning has to be appropriate for that multifamily to get 20, 30, 40 units. And our goal is to get them throughout the community so that we don't have all multifamily in one part of the community or just one subdivision. So we're going to look at different regulatory changes that we can do that makes affordable housing in general just easier for developers to pursue. I agree that landlords, for the most part in Iowa City, we work well with them. Now, do we work with them all well? No, but for the most part, we have some pretty good landlords. We are pursuing a form-based code in the Alexander neighborhood in the north side. That might be, it'll bring like a diversity of housing types. So instead of just seeing subdivisions of all just single family, you're going to see subdivisions that have a mix of housing in them. So you'll see single family with townhomes with multifamily properties. So we hired a consultant and we're in negotiations with that consultant right now to come up with a plan, especially for the Alexander, because that's new subdivisions are coming. It's basically green space. North side is pretty much built out, so they are only looking for infill developments. So we'll look at opportunities where we can bring that missing middle back in, but Alexander presents us with a huge opportunity of undeveloped land and subdivisions that are coming soon. Can you guys read that? I already talked about the LIHTC. Since we started this fund, the Housing Fellowships Project will be the first that receives money through our LIHTC program. We're looking at tax abatement. So we're looking at what level, if we're willing to abate taxes for up to 10 years by state code, when is that feasible? We're working with developers to try to figure out, okay, at what point will a private developer take advantage of this? Because if they have to do income certifications, if they have to monitor the project, they have to provide reduced rents. There's some trade-off. Like at what point will the developer say, okay, if I can abate my taxes, I'm willing to do it? So a committee's looking at that. We exempted the riverfront crossings from the affordable housing location model. The city does have affordable housing location model that dictates where we encourage additional affordable housing. So there's some parts of the community that we're basically saying, no, we already have a concentration of poverty in some neighborhoods, so we're not going to put additional affordable housing in those neighborhoods. And there's other neighborhoods that might not have any opportunities for affordable housing, so we're trying to work to get housing into those neighborhoods. So we do have a model for that. We have a tenant displacement plan, and that tenant displacement plan is more about notices. So if we don't have control over rezoning, and they're just going to non-renew leases, and there's going to be 12 or more, we want to know what notification they're going to go through. They have to give those tenants notification. Oh, and then the rent abatement for emergency orders, which we completed back in 2017. I also wanted to just touch on about how important existing housing is. Because if you look at a lot of low-income families, they're living in existing housing it's just not expensive, and that's where they can afford to live. Young children and elderly spend a lot of time in that house. So what can we do to make that house safer? So we sent our rental housing inspectors to training by the Children's Hospital, or Children's Mercy in Kansas City. And it was basically saying, improve the housing that you live in right now. So what can we do? And some of that's just education, that we don't have to spend any money, but it's educating landlords, it's educating tenants about what you can do to make your own housing safer. So radon, lead, and I can't believe how much moisture is a bad thing in your house. Whether it leads to mold, leads to attracts bugs. So the training really concentrated about how we can get moisture out of a house. And so our rental inspectors are looking at that. We inspect 19,000 rental units in Iowa City. So what we can do by code, we do so, but we're only out there every other year. And just to educate, so now with our Section 8 holders, our public housing, our rental permits, we're sending this flyer out to everybody. And we have it translated in Arabic. There's about 5 languages that we have this translated, that we can provide it. And that is about it.
Thank you.
Right.
Please join me. Questions, so we also have a microphone that will circulate, so if you'd like to ask a question, you can do it.
I'll start this off by asking, do we have any idea how many houses in the Iowa City area are rental versus owner-occupied?
Just the number? Well, we have 19,000 rental units. I'm not sure how many owner-occupied housing units we have, but more than 50% of our community is probably rental.
So when Casey did his figures, you had the university dorms. So are you talking about dormitories as well?
I'm not.
Oh,
I'm not.
no. I was just talking about in terms of the housing supply that they're bringing online. So the rental survey didn't get into dorms. If we do, this is a piece of a much larger rental survey. And so we have one area that's devoted to university housing, another area devoted to low-income housing, and then subsidized housing. So this is just a piece of it. If you want the whole thing, you got to pay for it.
Does that include senior housing, also the new coming online? Excuse me.
Yep. Does that include senior housing, the new?
I think it does, yeah, yeah.
Quite a
But you know
few-
what, I'll have to check on that to make sure, because I'm not 100% sure, but I think we were looking at just about anything, any new construction that's coming online, and clearly, the construction off Camp Cardinal Boulevard is a big deal. It looks like they're building an aircraft carrier over there, they have. So that's a lot of new units that have come online. That's a big, significant part of the supply.
Quite a few years ago, I remember there was a sort of a scandal where football players were living in Pheasant Ridge and whatnot, and how can you legally distinguish between undergraduates who have little income and adult family types?
We started a whole national debate after that one. It came back and HUD switched the rules, so now if you're under the age of 24 and you're a full-time student, you're basically not eligible for Section 8 unless you meet some protected class, like you have a dependent child, military, your family, like your whole family with your parents would qualify as low income. So they took away what a typical undergraduate student was doing, so it's no longer allowed under the Section 8 program.
But you have other programs besides Section 8.
Oh, you mean like with very rarely would we ever have an undergraduate student applying? Because we use the Section 8 definition for almost all of our housing. You have to meet that Section 8 definition, we just put it in the contract.
I'm curious, are there any programs for landlords or homeowners to get housing, to make some of those changes to make the house safer, like mold remediation?
Unfortunately, it's harder for rental because we hit up with federal lead rules if the property is older than 1978, which ironically is the exact housing that you probably want to rehab. But we do have an owner-occupied housing rehab program, so we allocate money every year. So if you're under 80% of median income, you can apply for rehab, but you have to own your own home. So we're trying to, we might apply for money, especially through the Housing Trust Fund or local money, because that way you don't have those federal regulations. Because if we have lead in a multifamily, we also have to, not only do we have to abate or lead mitigation for that unit, we have to look at all their common spaces and we have to mitigate or abate for those spaces. So it might have been like a $60,000 rehab project, just became $1 million and we don't have it. So we're looking for ways that we can, it's not like we want safe and healthy housing. it's frustrating because we can get into a unit, we can improve the safety of that unit, but now because of different regulations, we can't go into that unit at all because we don't have enough money to fix the whole complex. So it's just difficult.
So can I make a comment? And I'm learning along with many of the rest of you here. But I was looking at the 15 steps, that the city is going through, and I saw the $1 million being spent on the Chauncey for, I think it was 5 or 6 one-bedroom units, and the same thing for the Augusta, is that it, Jesse Allen's property? From an appraisal standpoint, and from an economist standpoint, I look at that money and I think, we're getting 6 units for $1 million. I don't think that's a good deal. And my thought is that if we're allocating funds effectively, $1 million, if it went to a fund that insured landlords against, deposits or the last month's rent for, the kind of people that, Crissy is serving, it'd just be a much more efficient allocation of resources. And I think those are the kinds of things that, as policymakers, we got to take a really close look at. The other thing that strikes me is there's got to be a way for rental properties and tenants who are renting, who don't own their own roof, for example, to take advantage of the solar revolution. And I think that, it kind of fits with a lot of the policies that the city is looking at. How do we facilitate not only solar on apartments, which have a hell of a lot of roof space, but tie that to rent and utility costs. And the third thing that strikes me, I know that, and I don't know how far it's gone, there's a lot of focus on LEED certification. And LEED certification, it really is it's a terrific thing, but it also, some of these policies are at odds with affordability. And I think that, it doesn't mean that you could expect a city or policymakers to be, perfectly efficient in everything they do, and they have to balance contradictory policies. But my thought is that if the focus, the new development is on energy efficiency, more so than, some of the characteristics of LEED certification, then again, I think it's one of those areas where we can spend our money more efficiently. And finally, the issue of prioritizing, I think that we need to be mindful of that, as going forward. And I think we need to, set that pyramid. I'm excited by programs that enable people to stay in their houses, that provide money for repairs, refurbishing, energy efficient kinds of things. I'm excited by programs that help people who are homeless get into a rental situation. I'm I'm excited by it, but in a different way, by seeing the city council spend $2 million on 12 units. So I think, those are the kinds of things that I think these are well-meaning things, but these issues are far too important to not spend our money as efficiently as possible. And finally, I'm really on my high horse here.
Your second finally.
Having said that, I forgot what the hell I was going to say. But I can tell you it was insightful and pertinent. And it'll come back to me in a minute.
That reminded me of a question that came to my head during the second presentation, which is that at the very end of the presentation, you mentioned the difference that it makes in their lives, but you spent most of the presentation talking about the money that we're saving. And I think that's reasonable and necessary. But is there a danger in focusing so much on the money and the efficiency, especially when something more efficient could be potentially less kind? Oh, sorry. A little bit more. There we go. Just that by focusing on the efficiency and the money, does it worry anybody else that we could be losing sight of the actual human impact? And the reason I thought this was during the second presentation, that we spent almost the entire presentation talking about the money, and then at the very end, it was kind of like, it does make a huge difference in their life, you know, and I think that's important. Do we need to focus more on that, do you guys think? Or is there a danger in not putting more emphasis on that?
So I think that's a very astute point. Some of the criticism throughout the 20 years of my doing this, of my work, is that we focused more on the narratives and the impact and the stories, and where's the data? And so if I've swung too far in the other direction, that's why. And it's also a part of trying to make this as broad a conversation and to build as much support across different sectors of the community, and bring people in who typically aren't interested, or it just hasn't resonated with them, because the cost impact part of the conversation hasn't necessarily either been a part of the conversation or the forefront. So it was unintentional that I did not mean to dismiss the human impact. And I'd say that I would hope that people understand that this shift that we're making to a housing first approach is absolutely, it has everything to do with being concerned about the human impact, not the efficiency of it so much as it is. Our understanding of it is it is absolutely the wrong thing to do, to invest in continuing to keep somebody homeless or to lengthen the duration of homelessness, because we can have such a radically different and positive impact by truncating that homeless experience, that episode, as much as possible, and getting people, irrespective of the cohort that they're following into, men, women, children, families, individuals, into their own housing, because of the significant impact that housing has on the health and stability of all of our lives. So I hope that I did not lose that or misconvey that. Is that fair?
Yeah, I didn't mean that to be a criticism.
No, it's point well taken, because we really have intentionally focused on that cost impact, because of the conversations that have happened throughout the years, which are essentially to kind of pat me on the head and say, well, that's very nice. What you're doing is very nice. You know, you're doing good work. No, we're doing profoundly impactful work, and we're saving lives and getting people to listen differently to us.
Other questions?
And I have literally been patted on my head.
Well, I wouldn't try that. I'll
No,
tell you
don't.
that.
Did it come to you yet? Final?
Yeah, it did. But we got a question here.
Question relates back to what you were saying. Tracy, could you comment upon the earlier observations regarding the high cost of providing affordable housing as a city policy in the downtown area?
Yeah, no, there is a trade-off. It is expensive. Even when you look at LIHTC projects with IFA and you see who they're funding, it's like $5-6 million to get 30 years of affordability for people below 30, 40, 50% of median income. So affordable housing in general over 30 years is expensive. That being said, the city council wanted opportunities in our downtown so that people who either live, work, or just want to be downtown could live. The only thing about is that it's permanent affordability, so it's not just 30 years. So when the city owns it, we own it. Basically, the funding source that we're getting the money through, it'll always have to be affordable housing. So let's say in 10 years, that property, we bought it for $200,000 is now worth $500,000. We can sell it, but that means we have to invest that $500,000 in affordable housing somewhere else. So it's basically permanent affordability. So if we ever do sell that, it still has to go for affordable housing somewhere else. So that was a choice that the council made at the time, is that they just wanted to expand properties in the downtown area. But it's expensive. There's no doubt about that.
Go ahead, Casey.
Well, your comment was a great one, because I was just thinking, my perspective is we don't talk enough about money. I mean, I know we spent a lot of time on it, but I think it helps rank priorities. And if you're serving people, having the resources to do that is very important, and not making the kind of mistake that the council did by investing $1 million in 6 units is telling. And I think a good, quick way of measuring that is how much money they spend and how could that money have been allocated more efficiently. I think now, more than ever, the city faces this question of a hostile state legislature that sort of did a, what do they call it, cut and run kind of a deal. They lowered the property taxes and they promised to backfill, and anybody that has dealt with the state legislature over the last 20 years knew that that promise probably wasn't going to pan out. And the city, to their credit, they have been preparing for that and allocating, budgeting to handle that backfill. But even so, the city has got to be mindful of the kind of property taxes that they've lost, in the last few years. And I think that when a decision is made, some consideration should be given to, well, what's the impact on tax revenues? What's this going to, do for or against us? And I think they do that, somewhat. But, and my wife told me, don't talk about this, but I should take her advice. But a good example, people have very strong feelings about historic preservation. How do you draw the line? At what point do you say, this thing has got to go or stay? Is it purely, an emotional kind of a thing? Is there a disciplined way to look at historic preservation and what it costs the community? Is there a trade-off there? Would it be better spent on affordable housing? Sustainability is a big issue. But I think, and that's that situation of policies conflict. And if you're going to set priorities, you spell it out, say, look, we want to preserve this particular property, even though we know it's going to cost us this much in lost revenues. But we know that, we're making an examined decision, and we're ready to move on. So I think those are the kinds of things that I'm driving at.
Casey, Mike Carberry, Johnson County Supervisor, and we're having to deal with that backfill issue as well. And we left enough money in our budget just in case they started taking the backfill away right now. But hopefully elections have consequences and we'll see something different in November. Because of that commercial property tax reform, which has caused the different taxation on multi-family units, which used to be taxed at commercial rates, and then it's being stepped down to be taxed at residential rates. Will we see more, will that tax change precipitate more building of housing units in Johnson County because of the tax treatment?
Boy, as I understand it, the way that is working is condominiums are taxed at residential rates, and they have been since the early 80s. And so everything that's been built since about early 80s has been a condominium, and they're taxed at residential rates. The units that were built prior to that are the ones that are apartments, and they were taxed at a commercial rate. And so the inequity is what pushed that particular legislation. That's a bigger impact to Johnson County, I think, than the commercial, the 10% commercial rollback, which is a different thing. So in answer to your question, it isn't going to develop one additional unit in Johnson County as a result of that tax change. What will is they have a labor, what do they call it? Labor force tax credit. I think it's $20,000 a unit. That's the kind of thing that makes a project, it's a go or no go kind of a thing. So that will have an impact on it. But that was just, I think they saw it as kind of an inequity, and rather than raise the condominium rate, they lowered the apartment rate. This is a little technical, but the fact is that when they lowered the condominium rate, by virtue of the taxes going down, the property values went up, so the assessments went up. So while they might have lowered it 40%, ultimately what they really did was lower it about 25%, which still is painful.
Okay, last question.
Tracy, I got a two-part question for you. First of all, when you're locating affordable housing, how important is access to reliable transportation, grocery stores, drugstores, and medical facilities?
It's considered. We look at it, but when you're developing on the outskirts of town, basically you don't have those things. So we look at how close to an arterial road we have. If you're close to an arterial road, there's going to be public transport or, public bus. So Even IFA used to have a scoring criteria based on location to neighborhood amenities. I don't believe they have that anymore. So we look at it, and especially for land banking, we have some guidelines that looks at, can't be in the floodplain. Is it by parks? Is it by a school? So we look at it, but there's no hard set criteria. But we do make sure that it's by arterial so that we know if it's at the outlying part of town, that we know it's going to be serviced at some point. Maybe not right now, but within the next 5-10 years, it will be.
The part of my question is, Habitat for Humanity is having a hard time building a house anymore for 150 grand. Land, building costs, and they have a lot of free labor. So when Casey was talking about 6 units and $1 million, that's like $166,000. And he was charging $400 a square foot, so that's like 416 square foot. I don't think that's a bad deal. I'm assuming your square footage is higher than that for each unit, but to be close to downtown where there's jobs, transportation, everything, that's not really that bad of a deal.
Yeah.
I think. I mean, I don't know what your criteria was for buying that.
For buying those units? Yes. I think they just wanted affordable housing component close to downtown. What we are seeing for new construction, 200,000 is not that out of line, especially with land prices in Iowa City. The state had a state workforce housing tax credit, and they allowed you get a state workforce housing tax credit basically for modest affordable housing. And you just had to make sure that you could build each unit for less than 200,000. So that to me is not a huge price, especially when you're talking about permanent affordability. So that means in 50 years, we still have that unit. Some of the other programs that we deal with, like inclusionary zoning, that's only 10 years. The state's tax abatement for affordable housing is only 10 years. So after 10 years, it's gone. It goes back to market rate. So that there is a trade-off for price regarding permanent affordability and a 10-year or 15-year period. Does that answer your question?
Again, thank you to our 3 panelists for their presentations and to the audience for attending.